It isn't working, and it hasn't worked. The fact of the matter is that you've got individuals who are paying more for premiums instead of less, which is what was promised. You've got people paying outrageous amounts for deductibles instead of less, again, which was promised. So you've got folks with an insurance card, but they don't have care, and that's not a system that works for people. It may work for government, it may work for insurance companies, but it doesn't work for patients, doesn't work for people.
Well, I think that what's important is that we get Americans the health care that they need and deserve, and that's why it's important that we make sure that we get this right for the American people.
Well, because it is hemorrhaging and the patient's going to die. And we need to stop the hemorrhaging, so we need to start the process of replacement with something that actually puts patients and healthcare providers in charge. And we need to really start thinking about what is the purpose of health insurance. In the beginning, it was to keep you from losing the farm if the primary earner became injured or seriously ill. We've allowed it to mushroom to the point where if we have a hangnail, we want that taken care of. That creates an environment that's rich for graft and confusion.
Because it hurts folks. Look, I'm one of the few people you probably talked to who was on Obamacare. I was on it as a member of Congress. My family was on it, and we went through, not the horror stories, because they're not horror stories, but it's the things that the previous administration lied to us about, okay? Our costs went up dramatically. I lost my doctor. I went into my doctor's office, and they refused to see me because they refused to carry my Obamacare coverage. So I lost my doctor. My wife lost hers. My kids had to go into a separate plan, so we had, I think, 5 different deductibles to meet in my family. It was outrageously expensive. It's bad care. It's bad coverage. It's not good for folks. And we were some of the lucky ones because at least we still had coverage. There's a lot of folks in the country now who live in an area that don't have any coverage at all. So it hurts people. My guess is that was by design when the previous administration put it into place because they want a single-payer system, and we have to repeal it so that we get rid of what's there now and don't replace it with a single-payer.
I think the record is clear. You've had premiums that have more than doubled. You have deductibles that are going up. And as the Vice President has met many people whose mortgage payment actually costs less than their health care payment. Well, that's just not right. Having an Obamacare card in your wallet doesn't do you any good if you can't afford to use it or if no hospitals or doctors will take it.
American families are hurting under Obamacare. They've been hurting for years. It's a promise that the Republicans have made to repeal and replace Obamacare since the 2010 midterm elections. Right now, Americans were promised premiums would decrease by $2,500 on average, and in fact, they've gone up over $3,000 per family. Insurers are fleeing the markets. Today, there's over 40 counties in America that have absolutely no insurer left on the private exchanges. There's over 1,300 counties that only have one insurer, just a pure monopoly in that particular community. So we need to provide competition back into the insurance marketplace. We need to lower premiums, which is what we're doing. And we're also protecting life. There are provisions in this legislation that will make sure that the sanctity of life is protected.